Hello! I want to welcome you to your digital preoperative education class for total joint surgeries. This video includes information for both total knee replacements and total hip replacements. We want to offer this format for you to reference at any time before or after your surgery, and you will also be receiving additional videos for your use after surgery to guide you through the next phase in your healing. With that, let's get going. What we want you to gain from this presentation is a basic understanding of the anatomy of your affected joint and the mechanisms which may have led you to this joint replacement surgery. We want you to gain an understanding of the procedure you will have done and prepare you for surgery and hospital stay. We want to address the most common questions regarding what to expect from your procedure, including aftercare. As with any surgery, there is always a chance of complications, and we want you to be aware of how to identify and prevent them as best you are able. We also want you to be aware of practices you can put into place to allow for the best outcome possible. A joint is where two or more bones come together to provide movement of your skeleton. In the knee, the femur or thigh bone, and the two lower leg bones, the tibia and fibula, come together in a hinge joint, with the kneecap or patella at the front of that joint. In the hip, the pelvis has a small bowl shape that captures the end of the femur where the joint moves. Muscles attach to portions of the bones for movement, and healthy joints allow for pain-free mechanics at the joint. Osteoarthritis is an inflammatory condition of your joint. As we move throughout the day, your joints will take weight through them. Osteoarthritis develops for various reasons, maybe an old sports injury or a traumatic car injury, but for most of us, it is general wear and tear on the joint. The ends of the joints are covered in cartilage, which allows for smooth movements and some shock absorption. Osteoarthritis eventually erodes the cartilage on the end of the joint and can also create osteophytes, sometimes called bone spurs, which can also be painful. Between the worn cartilage and bone spurs, movements can be altered, which may also lead to joint deformity. When the pain and stiffness starts affecting your ability to care for yourself and participate in your normal activities, your doctor may recommend a joint replacement. Joint replacements can occur in many places in the body. We are going to focus on replacements for the knee and hip. Your doctor will discuss your specific approach with you at your appointment, and this will also be reviewed with you at the hospital after your surgery. Starting with the total knee replacement surgery, your surgeon will make an incision on the front side of your knee to expose the bone and cartilage. They will replace the end of the thigh bone, or femur, and the shin bone, or tibia, with a metal component and a synthetic surface to allow for smooth gliding. Depending on the condition of the kneecap, it may need to be reconditioned on the underside. In hip replacement surgeries, an incision is made through the soft tissues to allow the surgeon to access the hip joint. The head of the thigh bone, or femur, is replaced and the bowl portion of the pelvis, called the acetabulum, is honed, and then a cup is inserted either with screws or cement. For joint replacement surgeries, be aware that bones and soft tissues require at least 6 to 8 weeks to heal, sometimes longer depending on any barriers to healing, such as smoking or other conditions that impede healing. To have the most successful surgery, you will want thorough preparation. As with any surgery, the better you are able to take care of yourself prior to the surgery, the faster you will recover after surgery. In general, maintaining a healthy weight, avoiding smoking, and having good nutrition will play a part in laying a good foundation. In addition to added vitamins and minerals, plant-based foods will increase your fiber, which will be helpful in aiding bowel movements when you are taking pain medications after your surgery. A good guide for fiber intake is 20 to 30 grams per day. In addition, increased protein will aid in healing your tissues. Aim for around 80 grams per day unless contraindicated by your doctor. Prehabilitation is a fancy word for being active, increasing your muscle mass and balance before surgery. Your guidebook has a set of preoperative exercises in the back. There are 5 exercises including armchair push-ups, straight leg raises, foot kicks, heel raises, and side kicks. Complete 20 repetitions of each daily as you are able before surgery to give yourself a boost for recovery. Now let's shift to your home setting. Do a thorough check to ensure you have good lighting and no trip hazards that need to be fixed. We're talking about things like rugs, cords, and loose thresholds. Move items you will be using most to the front of the countertops, top drawers, and shelves in your kitchen, bathroom, and bedroom. After your surgery, you may find that you feel weak, stiff, and possibly unsteady. Always walk with someone using a gait belt until cleared by your therapist or doctor. Success in your home will be maximized by ensuring that you have surfaces that are tall enough to sit and rise from easily. A good general guideline is for the seat to be higher than your knee. If there is a cushion, it is measured with the cushion compressed. Find a comfortable seat to be in throughout the day and easy enough to get in and out of hourly to move. You should have a footrest available to allow for elevation when you're seated. Also look at the height of your bed, ensuring it is high enough to get up from easily but not so high that it is difficult to get into. Your toilet seat is another seat that is typically low. Practice getting up and down from it using your counter or grab bars prior to surgery. If you feel it is too low, you can purchase or borrow a commode chair or raised toilet seat. Depending on how you feel standing, you may also want to invest in a shower chair. These can be borrowed or purchased as well. The therapist will review your personal circumstances with you at the hospital. When preparing for the hospital, please find someone who can assist you not only to bring you there and back, but also to be with you for a day or two while you are walking, exercising, and healing. Importantly, when packing your things to bring to the hospital, please bring a front-wheeled walker with you. These are different from the walkers with 4 wheels and a seat. The 2-wheeled walker is more stable and helps you to be more upright. We encourage you to borrow one, find a used one, or purchase one on Amazon. Most patients will need a walker for only a short period of time and should transition off of it quickly, thus needing it only temporarily. Your doctor may have given you a prescription to use for insurance to pay for it, which you are welcome to do, but you may want to check into your benefits for your mobility devices. Your insurance may only pay for one mobility device every 3 to 5 years, so it may be wise to save it for the future. Other items to bring are toiletries, glasses or hearing aids, a change of clothing, preferably loose. If you have any special equipment you need, such as orthotics or a CPAP mask, don't bring the machine. Please bring those as well. You are welcome to bring an electronic device with the charging cord. Items not to bring include jewelry, valuables, and personal medications unless you're told to do so. The day before your surgery, you will receive a call from the surgical center giving you your time to arrive at the hospital for your surgery. Maintain the medication schedule as instructed by your doctor or hospital nurse. If you are given cleansing wipes or soap, you will shower the night before with half of your supply, and then sleep on clean sheets in clean pajamas. Also prepare your bag with items to bring, and please bring your walker with you to the hospital. Our physical therapist can ensure it is fitted to you correctly and instruct you on how to use it. The day of surgery, you will use the last half of your cleaning solution. No food after midnight the night before surgery, and clear fluids are approved until 2 hours before surgery. This is when you will drink your surgical drink if it has been given to you. When you arrive, park in the front parking lot and enter the front door. Go through the lobby to the back hallway and turn right. Go down that hallway to the end and turn to the left to check in for your same-day surgery. You may have already registered, but if not, they will assist you with that then. You will then be taken back to your room to prepare and then meet with your nurse, surgeon, and anesthesiologist. Our anesthesia team uses a multimodal approach with pain management, meaning addressing pain with several different methods. Depending on the type of surgery you have, you will typically have a spinal block, which is injected into the space next to your spinal cord and inhibits transmission of pain signals. This will last 3 to 4 hours with some residual sluggishness of your bladder, which should be resolved before you discharge from the hospital. You will have some mild sedation as well. Knee surgeries may also receive what is called a local block to aid in local pain relief and typically lasts 8 to 12 hours, but you may have residual effects up to 24 hours after surgery. This local block will affect the motor and sensory function of your leg. After your surgery, you will be brought to the Post-Anesthesiology Care Unit, or PACU, and your family will be informed that you are out of surgery. When you are stable enough to move to the surgical floor, you will find that your blocks will start to wear off and sensory and movement will start to return. Once this block has faded enough, physical and occupational therapy will be able to get you up and moving. This is normally the time that you will start to transition to oral pain medications. It is important to note that you have had quite an extensive surgery, including having a tourniquet placed on your operated leg, so the expectations for pain needs to be appropriate. As your blocks wear off, your pain will gradually increase. We encourage communication with your healthcare providers, especially your nurse, to make sure pain stays below a 6 out of 10. We also recommend scheduling your pain medications about 30 minutes before you have therapy or any other intense activities, whether at the hospital or at home. There will be specific markers or goals to achieve prior to discharge. We will want to see that you are able to eat, urinate, ambulate with therapy, and keep your pain managed. There may be reasons for you to stay overnight with us. We welcome you but realize you will want to discharge home as soon as it is safe. We will be careful to monitor any conditions you have and work you through any side effects of your anesthesia and medications. If you will be with us overnight, we will have you keep a pillow under your ankle if you've had a knee surgery. This will help keep your knees straight. If you've had a hip surgery and need a wedge between your legs, we will help you maintain that position. You will have a polarized cube attached to pads that cover your incision site. You can keep this on overnight as desired, and it is yours to take home with you. You may feel the block wearing off and feel you can make it to the bathroom alone, but please, always call for help before getting up in the hospital. The majority of people will discharge home with outpatient therapy or home health and then transition to outpatient therapy, which is optimal. There may be circumstances because of complications or comorbidities in which you may need to discharge to a rehab facility. If this is the case, our case management team will help you work through what is required to transfer to a facility. Now, let's talk about a few things to watch out for after your surgery, especially when you're recovering at home. The anesthesia and medications have side effects of slowing your gastric motility. Your gut will be one of the last things that wakes up after surgery. You may experience some temporary nausea associated with those medications. Be sure to take medications with food in your stomach. You may also experience difficulty having bowel movements. Start being proactive from day one, even before if possible. Some ways of being proactive is increasing your fiber, walking regularly, drinking fluids, and using your stool softener regularly until you feel like you are back to normal. If you do not have a bowel movement in 3 days, contact your doctor or home health team. Proper nutrition will also aid in healing. Include fresh fruits, vegetables, and increase your protein. There may be some health conditions that would be affected with increased protein, so ensure that it is approved by your doctor. As with any surgery, you want to do your best to avoid complications. Blood clots are one of these complications that can happen with any surgery. To help with this, we encourage you during the day to ambulate hourly if possible. Complete ankle pumps when you are sitting, sit upright to encourage full expansion of your lungs, and wear your compression hose as instructed. If you see unexpected swelling and color changes in your leg, especially in your calf, which does not reduce when elevated, please let your home health team or doctor know. Because you will be less active, you need to also be careful to avoid pneumonia and other infections. This is one reason we have you clean thoroughly before your surgery. Ambulating and sitting upright will help lung expansion. Also use your inspirometer for deep breathing, but most of all, wash your hands. It will keep things clean and help avoid transmission of bacteria. We want to thank you for choosing Ogden Regional Medical Center. We hope you feel more informed and comfortable with your procedure. Please feel free to review any information in this video, and we look forward to seeing you here.